Hi, everyone. Today I'll be introducing a study that explores how high intensity, how a high intensity exercise bout affects landing mechanics in soccer players, especially those who have ACL reconstruction. Let's start with the basics. Locomotion refers to how we move, walking, running, jumping, especially involving the lower limbs. In sports like soccer, locomotion is critical because players perform complex high intensity movements like sprinting, cutting, and jumping throughout a match. On an average, soccer players cover about 10 kilometers per game, with a large portion of that being explosive movements like sprints and jumps. Now, when it comes to landing mechanics, we're looking at how the body absorbs impact after jumping, specifically how joints like hips and knees and ankles move and absorb force. Landing mechanics are crucial in injury prevention, especially for the ACL and or the anterior cruciate ligament, which is one of the most commonly injured ligaments in athletes. After an ACL reconstruction, once athletes return to play, their biomechanics, how they move, can remain altered. They might land differently or have deficits in muscle activation, which can increase their risk of re-injury or particularly under fatigue. The study was designed to test how fatigue from high-intensity exercise modeled by the Wingate anaerobic tests affects landing mechanics in two groups: soccer players with a history of ACL reconstruction and healthy players without injuries. The researchers focus on soccer-specific landing, soccer-specific tasks, landing after heading a ball. This is one of the most common movements in a match. They wanted to see how joint angles, muscle activation, and impact forces change before and after high intensity tests, and whether these changes differed between the ACLR group and the control group. Why does this matter? Because understanding these landing mechanics, especially under fatigue, helps us develop better rehab programs and reduce risk of future ACL injuries, both in recovering athletes and in healthy players. The researchers expected that players, especially those with ACLR, would show decreased flexion angles, meaning stiffer landings along with greater joint moments and reduced muscle activity after fatigue. Their goal was to see whether these changes were more severe in the ACLR group, which would suggest a lingering vulnerability, and with that, we will move on to the method section. So, what was measured? So, to start off, the study used is a quasi-experimental design, meaning that the participants weren't randomly assigned, but were selected based on certain criteria. There were two groups of soccer players, one group who had previously undergone ACL reconstruction surgery, and the other group had no injury of history and served as a control group. Each group had 18 participants matched by sex, age, and body mass index to make sure differences weren't due to physical characteristics. The testing protocol, researchers wanted to simulate a real soccer-specific movement, so they used a jumping landing task that mimicked heading a soccer ball. Each player had to jump forward, head a ball that was suspended from the ceiling, and land on force plates. This movement is common in soccer and is known to increase ACL injury risk, especially under fatigue. To test the effects of fatigue, participants completed a 30-second Wingate anaerobic cycling test. This is a brutal high-intensity sprint on a stationary bike that quickly raises blood lactate levels. They measured the lactate levels and confirmed that each player had reached at least 4 millimoles per liter, which is considered the anaerobic threshold. After the test, players immediately repeated the same landing task to capture their biomechanics under fatigue. The measurements taken were the team used a motion capture system with reflective markers on key joints in hips and ankles, knees and ankles. They also used force plates and surface EMGs to record muscle activity in the quadriceps, hamstrings, glutes, and calves. They specifically looked at the sagittal plane joint angles and joint moments. So, how much the hip, knee, and ankle bent or extended during the landing. And muscle activation patterns, particularly how the quadriceps, hamstrings, and glutes fired during landings. Each participant completed 4 trials before and after the high-intensity exercise bout, and the researchers averaged the data for analysis. So why does this matter? By using both motion analysis and EMG, the researchers could study not just joint movement, but also the muscular effort behind those movements. This gives us a full picture of how athletes land and how that changes when they're tired. They focused on the sagittal plane because it's mostly directed with forward movement and shock absorption during landing. While that means that they didn't analyze rotation or lateral movements, it gave them a clean, controlled view of joint loading and landing tasks. So the key results. First, the researchers expected that the soccer players with a history of ACL reconstruction would respond differently to high-intensity exercise compared to the healthy players, specifically to the ACLR group, would show reduced flexion, greater joint stress, and lower muscle activation after fatigue. But here's the interesting part. That didn't happen. In fact, the main takeaway was that both groups, the ACLR players and the healthy controls, responded very similarly after completing the Wingate fatigue protocol. So let's break it down. After the high-intensity exercise, both groups showed increased flexion at the hip, knee, and ankle. That means they landed on a softer position, which helps with force absorption. They also showed higher extension moments at all 3 joints, which reflects greater internal muscle effort to counteract the landing forces. Importantly, there was a significant decrease in quadricep activity post-exercise across both groups. So their muscles were working less efficiently after fatigue. No major differences were found between the ACLR group and the control group in any of these measures. What does that mean? So this tells us 2 things: that fatigue changes landing mechanics, regardless of history of injury. ACL reconstructed players, at least 1 year post-surgery, may recover enough to respond to fatigue like healthy athletes. This challenges the idea that ACLR athletes are always more vulnerable under fatigue, and it suggests that proper rehab and conditioning can restore functional symmetry and landing mechanics. So the conclusion is that at 1 year or more post-ACLR, high-intensity exercise-induced changes in landing mechanics are not expected to differ from those seen in healthy soccer players. So in simpler terms, if the rehab is done well for ACLR players, then there is not a higher risk and having poor landing mechanics under fatigue as we once thought. We do want to mention that there were limitations. The researchers acknowledged that themselves. The study only looked at the sagittal plane, so movements in the frontal or transverse planes were also important, which are also important for ACL injuries, weren't analyzed. The sample size was relatively small, and there were variations in the type of surgery and rehab experience among ACLR players. And finally, the Wingate test may not perfectly simulate the kind of fatigue players experience during an actual soccer match. So despite all these limitations, this study gives us a valuable insight that fatigue matters And we need to include sport-specific high-intensity fatigue training in both rehab and return to play protocols. And that pretty much wraps it up. Thank you for listening. Hopefully the audio worked this time. This is already the 7th time I'm doing this. I'm not sure why this keeps happening, but thank you for your patience. All right. Cancel. Let's go back here. Stop.